Indications of blood components.
Indications for blood components. Packed RBCs are given to patients with active or acute bleeding and patients with symptoms related to anemia. And in patients whom hemoglobin is less than 8 gram per deciliter in general. In patients undergoing brain surgery, the cutoff is less than 10 gram per deciliter. 1 unit of packed RBC increases 1 gram per deciliter hemoglobin in adults and up to 3 gram per deciliter hemoglobin in neonates. Indication for fresh frozen plasma. Fresh frozen plasma is given to patients who have bleeding or imminent invasive procedures with clinically significant coagulopathy. It's also given for treatment or prevention of coagulopathy in massive transfusion. It's also given in patients who have factor deficiency when the concentrate is unavailable or in cases of plasma exchange, especially for thrombotic thrombocytopenic purpura. The cryoprecipitate is indicated in treatment or prevention of bleeding due to hypofibrinogenemia and in disseminated intravascular coagulopathy. Also in hemophilia. The cryoprecipitate contains fibrinogen, factor 8, von Willebrand factor, factor 13 and fibrinoactin. It is stored frozen and must be transfused within 6 hours of thawing or 4 hours of cooling. The cryo-poor plasma is given in patients with thrombotic thrombocytopenic purpura. It contains most of the coagulation factors except von Willebrand factor and factor 8. Random platelet concentrate is given in patients who have thrombocytopenia or platelet functional abnormalities or bleeding due to thrombocytopenia. The cutoff in stable non-bleeding patient is less than 10,000 per microliter. In stable, non-bleeding and patients having fever or undergoing invasive procedure, the cutoff is less than 20,000 per microliter. In major surgery or invasive procedure with no active bleeding, the cutoff is less than 50,000 per microliter. In ocular surgery or neurosurgery with no active bleeding, the cutoff is less than 1 lakh per microliter. 1 unit of random donor platelet increases platelets by 5,000 to 10,000 per microliter.